Hey, what's up guys? It's Dr. O from Innovative Dental, and you're seeing this because you're interested in full mouth dental implants and want to learn more, which is very smart and wise of you. So we want to share what we do unique here at Innovative Dental and help you understand the process. I'm certain by the end of this, you will have learned a lot about full mouth dental implants and that you'll be more equipped to make a wise decision when it comes to what route to go. And so stick around. Let's go ahead and jump into the presentation. I won't try to take too much of your time, but I want to try to be clear on what we offer here. The Innovative Implant Smile it's this unique approach to full mouth dental implants that allows us to get from start to finish in a very predictable fashion, safely, and give you a premium set of teeth that do not come in and out, that are fixed on the implants, that you never have to go without teeth. So that's what the Innovative Implant Smile is. I'm going to dive into what makes maybe our protocol unique. But we're not talking about snap-in dentures. We're not talking about dentures at all. So this is a completely fixed, screwed-in set of teeth. You never, in this process, go without teeth. Sounds pretty good, right? Where does this all happen? It happens at Innovative Dental in Springfield, Missouri. We've been fortunate enough to take care of people from all across the United States. And I think we've had 48 states. So we're almost, we got a few more states to maybe get people to travel from. But we've been, been able to take care of them. They come in, they fly in, and get to head back home with a brand new smile on their dental implants. And so this place is really designed to make people not feel like they're at a dental office. Because I don't know about you, but I don't want to be at a dental office, and I'm a dentist. So I try to make a place that feels like a resort rather than a dental office. So for sticking around, you need to know what you're going to be getting. You're going to get a little bit of cool stuff in return. So for your time, you're going to be able to get a $5,000 voucher. You're going to get actual payment and pricing options, and you're going to save thousands of dollars on this procedure by just making sure you do it the right way the first time. So one and done is always better than whoops, I got to redo it again. You're also going to figure out what the premium same-day immediate smile is. That'll help you understand the process, okay? You deserve better than permanent teeth in 24 hours. So chances are, if you've done any research at all into full arch implant dentistry, you've landed on plenty of ads that promise permanent teeth in 24 hours. I'll tell you why you should run as far and as hard as you can away from that procedure. We're also going to talk about customizing and personalizing your smiles rather than just cookie cutter. Again, I want you to be really clear on this. Our patients are never without teeth. You never are leaving our office without teeth. That is like the last thing I want. Almost everybody else, or many, are sending their patients home with nothing the day of the procedure. So you go from coming in with, yes, teeth that probably aren't very nice and maybe are breaking down on you, but then you go home with nothing. And then I'm going to give you 5 absolutely necessary questions that you must ask whoever you're going to trust to do this treatment. I would expect you to ask me these questions. I would want you to. And if you're going to go anywhere else and get a second opinion, or you're just watching this to maybe learn more, please take the time, get these 5 questions answered. That'll save you a ton of frustration. Here's just some wonderful people that I've been able to help. I show this because they came in not so proud of their smile. And I know that a lot of people that are watching right now might feel that way, and I want you to hear really clearly from me. Our office is committed to treating people with love, kindness, and care, and I promise you, you will not be shamed. You will not be treated as less than, and we know that you are an amazing person, and this is just something that you are struggling with, and so it's a no judgment zone at Innovative Dental. Just trust that you're going to be treated kindly. We're really grateful that you're giving us a chance to talk about this treatment. 40 million people, you need to know this, are struggling with their teeth failing on them, right? They're either losing all their teeth and needing to look to get a denture or another solution, or they're already in a denture. And so that's a pretty big crowd of people that are suffering, and I want to try to help them, and our team does as well. Why is an Innovative Implant Smile life-changing solution for failing teeth? I want to share with you why this is the best solution in my mind. Hopefully I can make that case and make it very clear. And I would love, obviously, to hear your questions. If you have any questions, please call our office or message us, and we would be happy to respond. Also, you can message us through our social media. So any of our accounts, you're welcome to message there. I routinely answer those questions. So here are some main reasons why people may find themselves in a spot where they need to get a screwed-in set of teeth that we offer here with the Innovative Implant Smile. First one is going to be missing teeth, and you're missing your back teeth. Those are teeth that, they break down and you had a failed root canal and you need them out. This might be a great example of that, right? So this gentleman here now has solid teeth, screwed in on implants, never went one single moment without teeth. This is another gentleman who came in from Florida. His name's Josh. And so he had an infection. He's a wedding photographer out in the spotlight, didn't want to be toothless, said, hey, enough is enough. I don't want to be not healthy anymore. And I also want to have an amazing smile to represent my brand and what I do for people. And there he is now with his brand new smile, screwed in on implants, don't come in and out. This gentleman here had extreme wear. His name's Robert. He has no smile in the beginning, right? We try to give him a smile, say, hey, Robert, smile. And this is, I mean, a lot of you might feel this way, right? Don't want to smile. And, but look at him after, right? He's wanting to smile, looking really healthy, looking happy. But look what he was doing to the teeth, right? Extreme wear. Couldn't help it. He's clenching and grinding. Some of you might clench and grind at night. That's exactly what Robert was doing. And here we have Anne. I don't know if you can relate to this, but she felt like she was stuck on the dental cycle, going in and out nonstop at the dental office, never finding a solution that kept her healthy. She was constantly patching things and never getting to a finished smile, but now she has a wonderful smile screwed in on implants that doesn't come in and out, done in one visit, under a few hours. And then here we are with Larry. He had periodontal disease. So some of you might know what that is, but it's basically aggressive gingivitis that goes from gum issues to bone loss. And so without getting into the weeds, it basically causes the foundation around your teeth to erode away, leaving you with mobile teeth, bad breath, an unsightly smile, right? Lots of tartar, and becomes a really unmanageable problem. Know this, it's actually a large genetic disease. So a lot of people have tartar but don't have periodontal disease. This gentleman here had some mild to moderate tartar and severe periodontal disease and lost his teeth because of it, but got a brand new smile in one day. And now he's happy and healthy and no missing teeth and no wiggly teeth anymore. So, and just living life on with a nice smile. Here we have Sue-Ann. Maybe you're like Sue-Ann, right? Maybe it was a decade ago, or for her, it was 15 years prior to this. She had her teeth removed, she had a denture done, and she suffered for 15 years. You'll hear from her husband here in just a minute. And it's a pretty heartwarming story where she now can smile. She's no longer suffering. They can eat all the foods they love. And this is what she had before. And look at her now. Pretty awesome. Let me take you through a few quick ones here just to show you this is the transformations you can expect to see and witness for yourself, right? These are all awesome individuals that have trusted us with their smile and now have a solid smile on implants that doesn't come in and out. Where does this happen? Earlier, I showed you the outside of our office. We try to give as much attention to detail on the inside as well. We have this wonderful space for our full arch implant treatment. And you have a own wing on the upper level of Innovative Dental and private suites that are designed just for your comfort and your privacy. So you get to bring a family member with you. They can be part of the experience with you and enjoy this space while you get your new smile transformed that day. There's an outdoor space on the patio to overlook our courtyard. Like I said, we try to make sure that you don't feel like you're at a dental office. And I think we've succeeded pretty well with that. And hopefully you get to enjoy this space when you get your smile transformed. Hey, just a brief thing about me. I don't want to spend too much time on it, but here's my little buddy. I love barbecuing and grilling. There's my family, my wife and my two daughters. They're a little bit older now, but I love this photo. I'm never going to stop using this photo. So I got into this full mouth implant dental procedure and really didn't realize the transformation it makes for people. I want you to see this video of Brett. And it really helps land what's so valuable about this treatment. And it's just a personal, eye-opening experience that I think you're going to experience as well.
Again!
All right, simple video, laughter, enjoying the moment. What you don't know is this gentleman here has screwed in set of teeth on implants that don't come in and out. He got them yesterday, the day before this, right? I watched this on social media and I got all emotional, and it's because I realized I didn't just give him a nice smile. I didn't just give him the ability to eat, but the procedure we were providing Brett gave him the ability to just live life in the moment and not think about all of the things that can be distracting. So this is his brand new smile. Let's hear from his wife.
Now that I see him now versus, 8 years ago, I just wish that we would have done it sooner. You cannot put a price tag on how he feels about himself and his confidence and the way he carries himself. I still cannot believe the difference between then and now. Like, I didn't even think that changing his smile would bring us to where we are today.
So cool, right? Seeing the transformation. Obviously at the end here, she says, I just wish we would have done this sooner. She comments about how she feels like family. And there he is eating a burger the same week and he got his new smile. So pretty cool, right? Love these transformations. So the Innovative Implant Smile is an individualized protocol with screwed in set of teeth that don't come in and out, right? And we have these amazing affordable options. First and foremost, we're gonna deal with the plan. It's really important. We wanna develop a very clear plan because an ounce of planning is worth a pound of cure. So this is where people make mistakes. They rush into treatment. They don't use guided surgery. And so the procedure itself is then set up to have some problems and challenges. What do we do to get this amazing result? We're gonna take a 3D facial scan, a 3D bone scan, and then a 3D tooth scan. So these 3 different images that we take at all of our consultations allows us to build a replication of you in a computer, right? And so with that computer, we're able to design your new smile and give you a very predictable result using custom smile simulations and then mapping out each individual implant to be precisely where we want it to go and work with your new teeth. And so this is really illustrating all of this coming together in this one video clip. We're taking this 3D facial scan, we're planning where the teeth need to go relative to his current teeth, and then we're going to figure out where the implants go relative to that. And then we're using materials that are custom made, custom guides. There's 5 patents on this to help us make sure that we precisely execute exactly what we planned. That way this patient is going to get an amazing predictable smile. So you can see the implants in place there in the software, and then the new smile is going to be overlaid on that. And this is the really beautiful process coming together to give him in just a few short hours a final smile screwed in that he can go enjoy. What do you notice here, right? These are terrible. I'm so glad I had nothing to do with any of these smiles. I want to say that real quick. These 2 poor ladies, they suffered greatly. And it's because they trusted somebody too quickly. They didn't do the research, and they would tell you that. And they were wanting to get these things fixed, right? They came to me wanting that fixed. So what you'll notice is no planning on that upper left image means the implants are in the wrong spot. The teeth are coming out of the face. You'll notice in the upper right, they're crooked. And beyond that, you'll notice that these are zirconia, but they look very, very cheap. And it's because zirconia needs to be detailed really well. It doesn't matter if it's zirconia, it matters how the zirconia is finished. I want you to see what our patients get to leave with, what their experience is that very day. And here's Tuan Duong. Let's hear from him.
Oh, wow.
What you thinking, man?
Cool.
Awesome.
I'm speechless.
Isn't that great?
Wow.
Sweet. You were such an awesome patient. I appreciate it, man. I'm thrilled for you.
Thank you.
Yeah.
God, I wish
Go
I
ahead.
would have
Go ahead and
done
bite
it.
together again. Bite down.
Like normal.
Yeah, we just had
Yep.
a really solid bite already, day 1. No bite adjustment. It's cool.
Wow. Awesome.
Thanks. Pretty great, right? So he's a little numb, you can kind of tell, but those are the teeth he got to leave with that day. So they're really nice teeth. They allow you to heal and allow you to evaluate, and that way we can give you a perfect smile when we're done. I want you to hear from Bill because this is really interesting. This is a week after his smile day. So he got his teeth taken out, his implants placed. He has a brand new smile on these freshly placed implants. He's only 1 week out from the procedure. I call him up and I say, hey, Bill, how are we doing, man? Hopefully you're doing good. Let's hear from Bill.
Hey, Doc, how you doing?
Wonderful. I just wanted to check in on you and see if you're feeling all right.
Man, let me tell you something, Doc. I haven't felt this good in 3 years since I got out of the military. All that,
awesome.
I remember you telling me you were scraping infection out of my mouth.
Yep.
My elbows and my shoulders, they don't hurt anymore.
Wow. That's awesome.
My smile is absolutely phenomenal.
Yeah.
I've gotten 12 compliments on it.
Oh, that's great.
Oh, I'm so happy, Doc. I'm so happy with you and your staff.
Oh, man.
I can't wait for my wife to
Yeah.
get hers done. I'm ecstatic. Well, I can't. I mean, never. If I only live another 5 years, it'd be the best 5 years of my life. I appreciate it so much.
How great is that, right? Get to hear from Bill, and he's feeling better. He's feeling healthier. He's sleeping better. No more aches. It's just really amazing. If I didn't play that for you, you probably wouldn't believe it. I wouldn't believe it. It's kind of crazy how getting the teeth out that are infected, the periodontal disease he had, dramatically improved his health. Pretty cool. There's he and his wife, Sue-Ann, enjoying their new implant smiles together. They made it a couple thing, so pretty nice for them. Moving right along, we're going to talk about what your smile day looks like. So you're going to have about 30 minutes of getting comfortable. We're gonna do the upper implant smile, which will take in less than an hour. I have that overestimated there, but an hour to hour and a half would be the longest. Then you're gonna take a break for about an hour, and then about another hour, hour and a half, which is gonna be a little less than that now. I think all of our patients now are 45 minutes to an hour for the procedure. And then you're gonna wait maybe 24 minutes. I tease with the 24 minutes because these companies promise permanent teeth in 24 hours. We give you a premium healing set in 24 minutes. So you're not going toothless overnight while we try to make your teeth, your permanent teeth overnight, which is a while to me. When you come back after 16 weeks, we're gonna take a tissue impression. This tissue impression is gonna allow us to create your final set of teeth to make sure they fit your gums properly. That way there's no gapping, and that way they feel right. And then we're gonna redesign the smile to make sure it completely functions ideally. What does that mean? You get a final set of teeth that don't feel fake, and you're gonna wanna take a selfie, just like this patient here did with me. Pretty fun, because he didn't even wanna smile in his before photo. How do we get this result? Well, we do prototype try-in. So if our healing set, which honestly, 3/4 of the time, we're gonna hit it out of the park with your healing set. You're gonna love it so much. We're just gonna copy the tooth positions for that and finish it up with a lot of detail and make it out of a more strong, permanent material that's got a lot of handcrafted nature to it. But sometimes we try in these prototypes and we go, wait a second, that doesn't look, it looks good on a model, but it doesn't look good in the mouth. That's the importance of try-ins. And so this is why we don't go permanent teeth in 24 hours. We wanna have an ability to evaluate what we think is gonna be an amazing smile and make sure that we've landed that first and that you feel good in it. After all, you're the one who has to wear this every day. So what does that mean? When we go deliver a final set of teeth, it's this simple. We know the patient's gonna love it. That's awesome for both of us, right? We want you to love it. You wanna love it. And it's just unscrew the healing set, screw down your permanent set, and voila. She's gonna be able to smile and perfectly fitting her face and looks wonderful. 3 reasons to avoid the permanent teeth in 24 hours. There's so many beyond 3, but I'll give you this one, okay? So static versus dynamic, you're gonna mess up these 3 things: the fit, feel, the bite and the function, and the aesthetics and the smile. And when we do that, we get something that's not so great, and it's because we try to rush something that takes time. The bite being changed and the teeth positions being improved, my guess is you're getting this procedure because you need these things changed. And so what do I know? These permanent teeth in 24 hours providers, they will tell you in the fine print, not in their videos, right? They want you to think this is over in 24 hours. They'll tell you in the fine print, oh, by the way, we're just using a material that's considered to be permanent, meaning they know that it's not a permanent material or that's not a permanent process. It's not done in 24 hours, even though that's the marketing claim. That's the way you're made to feel. And then they also say that they're going to, people like us that don't do it this way are going to be using denture conversions and working with dentures. Again, you'll not be using dentures. This is a false claim. Nobody that I know that's serious, including ourselves, is putting people in dentures. We're putting you in a immediate healing set, screwed in on implants that looks wonderful and allows you to heal, evaluate, and adjust to your brand new smile that you paid a lot of money for. We're not trying to rush it overnight. Most common questions we get: will I ever have to go without teeth? Hopefully everybody is listening, going a resounding, absolutely not. He said that so many times. You come in, teeth come out, implants go in immediately, screwed in set of teeth, leaving with teeth that day. This photo is 24 hours later. You can see she has her healing set in her mouth right now. Pretty awesome. Let's hear from a few patients about the day after. How do they feel? I'm here with Brian. He just had surgery yesterday. Give us just a little insight into how you feel.
Today I feel great. I feel amazing. No pain whatsoever. A little bit of swelling, which is pretty normal, but other than that, the pain doesn't even exist.
Okay.
It's absolutely amazing.
Awesome. So, smile for us, man. So this is less than 24 hours, right? We're looking at maybe 13 hours ago we did the procedure. Yep. So feeling great. What about during the procedure?
During the procedure, to give you an example, I didn't even know that you'd even extracted my bottom teeth.
Nice.
Amazing.
So safe to say, no pain, didn't hurt.
No pain.
Cool. Yeah. So thanks so much. You're an awesome patient. Look like $1 million, man.
I feel like $1,000 million. This is
That's
amazing.
Incredible. Just surgery yesterday.
Yeah, look at that.
Heck yeah. How did you feel yesterday though? What was the experience like?
Oh, during the procedure? Flawless, painless.
Really?
Yes, literally painless, nothing. Went home, started taking medication. I slept like a baby. I mean, you see it.
Yeah.
I'm here.
It's
I love it.
fantastic. Sweet.
Don't doubt it. Do it. No, this was awesome.
Yeah, cool.
I can't
Well, thanks so
recommend
much.
it. Can't recommend it enough.
So will I have enough bone is a common question. The great news is with the technology we utilize, as you can see here in this image, we're able to utilize minimal bone with guided surgery. So because we can hit a very small amount of bone with a very precisely placed implant, we don't need the same volume of bone as many people do. So that gives us optimal results, and all of it is part of the planning and the process. What will my first teeth look like? And I would want to know that. Will I love the way they look? Am I going to be really disappointed? And so the technology, the planning, that all those images we take in advance and the way we're utilizing that to design your same day healing set. This is a little bit of bruising on the behind the beard on that second photo. And this is literally like 3 days later. Pretty cool, right? He had one tooth and he had this whole smile completed immediately, and clearly fits his face wonderfully because the technology is that great. How much will this cost? You need to know, right? We want to make this affordable. So we can do this for as low as $225 a month per arch, as long as you have a 675 plus credit score. That's the range in price. Now with a full mouth, it's going to be $450 to $600, $700, $800, $900, depending on the payment option you choose, okay? We help so many people that think that this is just too far out of reach. If they have a decent credit score, we're able to give them this smile and change their life. And the return is so good that financing it makes a whole lot of sense. This is something that should last you the rest of your life. And how awesome is it if we get that type of return on our money with something we use all day, every day? Well, here's the 5 things you need to know are involved in the cost: the implant, the providers, the process, and the lab and the materials. The reason why you want to know this is we've thought through all of this and how to keep our process affordable. I'm sure many have, but I want to share why we feel like we've kept this affordable. The implant, we do not charge per implant, which helps our patients save money. We're not trying to, limit the number of implants to save you money or charge more by placing more implants than you need. We try to place the optimum for you, and our fee is flat. So we're going to give you the best system with the right number of implants, which is the minimum of 4. But many of our patients are getting 5, 6, 7 implants per arch, screwing in a total of 12 teeth to 14 teeth per arch. So you're getting 24, 28 teeth, full mouth back of teeth. So it's a full smile on these implants, and we try to use as many implants as will really fit correctly in your mouth. The providers, you're looking at it, right? So the reality is we don't want to have this divvied up amongst many, many providers. That's where confusion comes into play. That's where passing the buck, whose fault is, who planned this, who thought through this, why is this implant there? We want to do the whole thing with one doctor. So I do the process start to finish, and we actually do the lab here too. So we don't outsource the prosthetics, so the prosthodontics design. So all of that's done by myself and our in-house lab. The process, it is a repeatable, technology-driven 5-patent process that we're not trying to make this thing drawn out over time. We're compressing it. This whole transformation happens in a day and then is finished within about a 4 or 5 month window for our patients when we get to the final teeth. But that's not a surgery. It's not really even a procedure. It's an unscrewing of the healing set and then a screwing in of your permanent set. Then the lab, we control the lab, we own the lab, it's in the building, and that way our communication is super clear. And our quality, our handcrafted smiles have tons of detail that really sets it way above the national average. That's why our patients will claim they love their smile because it looks real and they feel like they can smile in a way that isn't reserved because they're proud of their realistic teeth. You'll never find more transparency when it comes to what you're actually getting from us. And that's because if you go right here to the Innovative Tooth Fairy Instagram page, you'll scroll through this and you'll notice she posts all of the technique and the designs and the way her teeth look, and fat chance finding hardly any other practice doing this much exposure of showing what their teeth look like. And it's because we're very proud of what we're putting in your mouth. Most people aren't probably very proud, or they're rushing it, or the detail's not great. Ours look incredibly realistic, which is allowing you to forget you have fake teeth. That's what we want. The materials, we offer 2 materials here that helps us save our patients money and keep them out of a denture. First, we have an affordable solution that we call our transitionary smile, our transitional smile. It allows us to keep people out of dentures by not cutting corners in quality of the procedure that is not reversible, right? We want to design the smile right. We want to place the implants correctly. That way, our teeth that we put on there could be changed out into a more permanent premium zirconia. But we use a lesser expensive material, allowing us to keep our cost extremely affordable. Most people find that the cost of screwed-in teeth at Innovative Dental with this transitional solution is approaching what you would pay for snap-in dentures. So it's a totally different procedure, so much better, as you can tell on this patient's smile. And it's a smile that doesn't come in and out. And when she wants to upgrade, she'll just pay the difference. And so it's a great solution for our patients, $225 a month per arch. The premium smile. Now, this is what we're most proud of and probably what we're most known for. And moving forward at our practice, this is really the difference maker. It's that we do not make this monolithic, ugly, non-detailed, fake-looking smile that you see. That is not something we would be proud of. And so we utilize a very detailed, handcrafted material there, lots of detail going into it to make sure that our patients have a smile that they can forget is fake, right? That's what we want. So our price for that is a little higher. It's $330 per month per arch. And so for a full mouth, you're probably looking at $660 per month per arch, as low as that, right? So, but a material that's really a permanent material, doesn't wear, chip, stain, and has the most amount of detail. The Innovative Smile Club is a fantastic solution for our patients. It's $500 a year. It gives you 2 yearly cleanings, 1 yearly exam, and 1 remake should you have your transitional smile break. It also gives you 10% off an upgrade to the premium solution. So it is a great way to ensure you, while you're transitioning from your smile that was failing you into a permanent premium smile, handcrafted zirconia, you have some insurance to protect you from a breakage and fix that up. So thanks so much for watching. I'm coming to the end here. I've got those 5 questions you must ask. Scan this right here, and you're going to get the $5,000 for watching this as you fill out that form. We'll make note that you watched this webinar and make sure that because you're now an extremely educated patient, you understand the process and the procedure, that you'll be able to have a much smoother experience at our practice, and you'll understand what sets us apart and maybe why you want to trust us with your smile. Getting an Innovative Implant Smile here would be our joy, and I think life-changing for you. We've got a promise to our patients. We want you to give us a second opinion because we're going to promise that we're going to be the most affordable when we're talking about the same thing. Where people get kind of tricked is they think they're getting a better price and they're not getting the same thing. And so we're going to have this experience, quality, the volume of implants, and price component that is our promise to you that you're getting the best value for your hard-earned money. These are the 5 essential questions everyone must ask. Like I said, if you come here or you don't come here, you got to ask these. These are critical. So what are they? Permanent teeth in 24 hours. If I'm getting permanent teeth in 24 hours, you got to ask them, what about the fit of my permanent teeth after 24 months? What's the space going to look like? What am I supposed to do about that space? And what they're going to tell you is they're going to take out your permanent teeth and they're going to try to add to them. That is not a great solution. And then what about the fit, right? The feel, the function. How are you going to evaluate any of those things? So you need to make sure you ask them. I would tell you just avoid any place that's promising you this anyways. I do think they're inferior because they're using a marketing tactic that's an overpromise and going to be an underdeliver. And I've hopefully explained that for you. What lab was used? You'd want to know that. You can ask the front desk or ask the person on the phone, hey, where do you guys get your teeth made? And hopefully they're saying like they'd all know the lab. That would be good. Even better or great is that they say, hey, we make the teeth, right? We have our own technician. We make them here. We control the process. Are the fees flat? I'd want to know, hey, is this going to change or is this fee set in stone? And then who's the doctor? I can't tell you how often I hear from second opinions. People are telling me that they never meet the doctor. They go in and they have a consultation, they talk with the salesperson, but they literally never meet the person who's going to be drilling implants into their face and creating their new smile. That seems wild to me. I don't think anybody should be getting that poor level or standard of care. They should be getting to meet the actual surgeon, the prosthodontist. Hopefully they're the same people, but if they're not, you should meet both. And you should be able to see where the teeth are going to be made, hopefully. Am I getting a good vibe? This is kind of like the gut check. At the end of the consultation, when you're on the phone, do you feel like you could trust these people as people? Because if everything goes smoothly and you're an easy case, then fantastic, that's wonderful. But if there's any hiccups along the way, you have any challenges, or things don't go as planned, you want to be in the hands of experts who truly care about putting you and your health first and your new smile, that you've trusted them with their money. The trust value, the good vibe. If you do not get a good sense that you can trust these people with something so important, like I said, it's a lot of investment, but maybe even more important than the investment is, can you trust them with something as important as your smile and all that it provides for you? You're wanting this fixed. You want a new lease on life with a new smile, and you deserve the very best. So that's my message to you. It's been an honor to talk to you about dental implants. I would be honored to take care of you here at Innovative Dental. I know you would love our team. If you'd like to talk more and have a consultation, please call the number there on the screen, 417-783-3161, or visit innovativeimplantsmile.com. Thanks so much. Have a wonderful day, and look forward to seeing you at Innovative Dental.